here's an interesting spin on it. You ever heard of white coat hypertension? There's been a lot of studies that have shown stress-related or white coat hypertension is responsible for about 1/4 of elevated high blood pressure readings. So what that means is you are completely anxious, you're going into the doctor's office, you really don't want to be there, you're totally stressed out, you get your blood pressure reading that's high. If you were at home relaxing on the couch and you sleep, they come in and take your blood pressure, it would have been completely fine. This is what can cause a false high reading. An anxious patient, especially if you talk immediately before or during the inflation of the cuff, that can increase blood pressure up to 50%, just talking while they're inflating the cuff. If your arms are larger, most cuffs are one size, the time of day, if the room is cold, if you have a full bladder, if you hadn't done any type of eating, drinking, or smoking within the hour before you get the testing done, if you've been standing, sitting, or supine, it can completely change it. So the ideal situation is that you've been sitting for at least 5 minutes before it gets read. If you've had coffee that day, if there's any emotional stress going on, if you've taken over-the-counter drugs, especially ones that contain caffeine or decongestants, they can all change the reading. So I say that especially if you've never had, say, high blood pressure, you go to the doctor, you have it, you gotta get retested. You have to make sure, go back 3 or 5 times over the course of a month to make sure that's an actually true reading, because oftentimes the readings just aren't even accurate.